if we could take a moment just to think about the beautiful faces that all of us see here, this is health equity. And we think about a world where health equity exists for many individuals, families, and communities. Yet we know that that is not the case for many of us, particularly populations that are underserved, at risk, and vulnerable. And so we're always constantly striving for health equity, and that's giving people what they need, when they need it, and in the amount that they need it. And that is part of what we are trying to accomplish, that we are accomplishing within the TCC, which aligns seamlessly with the vision of Morehouse School of Medicine, which is leading the creation and advancement of health equity. We're dedicated to excellence and relative to science, education, community-based programs, ways in which we engage with community members such that we truly listen to what their needs may be and try to respond to those needs in an effective manner. I recall about 6 years ago when we first considered applying for the TCC, and it was a very interesting opportunity, and we looked at supporting or being partners with another institution, another university. And Dr. Valerie Montgomery Rice, who is our president and dean of Morehouse School of Medicine, at the time she was the dean of Morehouse School of Medicine, she said, no, absolutely not. You need to actually lead and be the ones who are submitting an application from Morehouse School of Medicine. We had a strong team here that can do it. And so we looked around and collaborated with several different departments, centers, and institutes here at Morehouse School of Medicine, including the National Center for Primary Care, the Prevention Research Center, the Clinical Research Center, and others. And we recognized that we really can pull together a strong application. Of course, this was guided by many dictations of Dr. Satcher's, and listening to his conceptualization of health equity, addressing health disparities, and ways that we can work collaboratively with communities relative to addressing these disparities in health. And thus we went through a pretty intensive national review process, a vetting process that ended positively for us, and we were able to get awarded $13.5 million. And Dr. Satcher, where are you? Dr. Satcher, thank you so much for everything that you have done for us, and being able to model ethical leadership through integrity, and so many individuals, whether it be community members, scholars, community-based individuals who are representing community-based organizations, faculty, staff, students, etc. We have been empowered by you to truly lead the creation and advancement of health equity. Thank you so much, Dr. Satcher. Welcome. And so when we turn to looking more closely at the Transdisciplinary Collaborative Center for Health Disparities Research, again the TCC, I am delighted that we have been funded by the National Institute of Health, National Institute of Minority Health and Health Disparities, and Dr. Hopkins is our project director, Dr. Ophelia is a co-principal investigator, along with me as the principal investigator. And I think about the ways in which Region 4, which is our focus area, our primary catchment area that we are looking at, and it's, as many of you can imagine, has so many different disparities relative to any number of different mental, behavioral health, and overall health disorders. It's known as the stroke belt, the belt that is concerning diabetes, the cancer belt. I mean, the list goes on and on. I'm a Southern girl from Virginia, and for me, I certainly enjoyed many of the cultural tenets of being from the South. Some of you enjoyed our Southern style breakfast this morning. Yeah. But I realized realized that I had to change some things with myself, my lifestyle, relative to my diet, exercising a little bit more, because my life simply depended on it.
That's right.
There wasn't a question of, should I do this, X, Y, and Z? I had to.
Right.
Otherwise, I would be in the population or community that is deleterious with any number of different disorders that we've spoken about. And so I shift now to the TCC, and we are very pleased in the work that we're being able to do, in such that we are interested, willing, and able to engage with communities such that we're addressing some of the health disparities that exist. We are advancing health equity, truly. And one of the goals of the TCC is to develop, evaluate, implement, and advance science, and to use that science such that we can have certain discoveries and to reduce disparities in health. And so our first project, Sub-Project 1, is focused on helping parents, many of which are our first teachers, and we have to learn from our parents. So if we can empower them to be in a position to know and understand how to address social and emotional health for our children, that is great. And so Sub-Project 1 focuses on that, and currently we are in 13 states across the United States, which I'm very proud of. Sub-Project 2, Project Thrive, is focused on the development and implementation of a culturally centered integrated care model that addresses co-occurring depression and selected chronic diseases. Diabetes and cardiovascular diseases are what we have chosen. And so we partner with great health systems, and we're currently engaged in and working with several community-based health clinics in order to actualize this research project. So Project 3 is using health information technology to eliminate health disparities. It's led by Dr. Mack, Dominique Mack, who oversees our National Center for Primary Care here at Morehouse School of Medicine. Sub-Project 3B is using innovative ways or strategies or approaches to support patients from a holistic, comprehensive viewpoint, from a multidimensional perspective, and how we can address some of the health concerns or needs that they've identified, including diabetes. And so that's Health 360X. And Sub-Project 4, many of you may have heard of or may be aware of the 1988 Institute of Medicine report, which was entitled The Future of Public Health. Within the report, it was referred to that the need for leaders is too great to leave their emergence to chance. And so our Sub-Project 4 is focused on how to train, develop, support leaders, health leaders in particular, postdoctoral fellows, relative to understanding how policy is a thread that can be used or should be attended to throughout various aspects of the work that they do. And so Sub-Project 4 is one that is really an outgrowth of some of the work that's being conducted within the Stature Health Leadership Institute, our Health Policy Fellowship. We have many different professionals, young professionals that are across the country making a difference as it comes to health and health disparities in different communities. And so collectively, our work is exceptional. We are doing a great job, and we significantly add to science and discovery. In addition to the research projects that are being conducted here within Morehouse School of Medicine, we recognize and know that we needed to have a community component such that we are able to engage with communities, work with communities, and have partnerships with community-based organizations, in addition to working collaboratively with our academic institution. And so through competitive processes that have been conducted, some of which you will participate in later on today in today's session, Shark Tank session, you'll see that we have done a tremendous job of trying to make sure that we address community health issues, whether it be LGBT health issues, whether it be breastfeeding, cancer screening, diverse topics that have been identified as top priority among community members. And so up to this point, we have been able to award approximately $1.3 million to community-based organizations. 22 communities have been able to receive support from us. Now I'm going to shift next to Dr. Kamara Jones. Many of you know that she is the immediate past president of the American Public Health Association. She's an exceptional leader, thought leader, when it comes to health equity issues, particularly racism in health. That's one of her primary areas of focus. She's a faculty member here at Morehouse School of Medicine in the Department of Community Health and Preventive Medicine, the Satcher Health Leadership Institute, as well as the Cardiovascular Research Institute. And so please join me in viewing her conceptualization of health equity.
Health equity is assurance of the conditions for optimal health for all people, where assurance is a process, not an outcome. So we all have the goal, we share the goal of the attainment of the highest level of health for all people. But if that's how we think of health equity, what if we hit that last Sunday? Are we done? And health equity is not an outcome, it's a process, which process assurance, which is actually one of the 3 core functions of public health identified by the Institute of Medicine, along with assessment and policy development. Assurance of what? Of the conditions for optimal health. Those neighborhood factors that we talk about when we talk about the social determinants of health. And for whom? For all people. That makes it equity. Achieving health equity requires at least 3 things. Valuing all individuals and populations equally, recognizing and rectifying historical injustices, and providing resources according to need this year. And my presidential initiative has been to launch the American Public Health Association and including our members, our affiliates, partners in other sectors, community members across the board in a national campaign against racism. The point of that being that we need to name racism as a threat to the health and well-being of the nation, say the whole word, racism. Don't stop at race or cultural competence or implicit bias. All of those are important things to talk about, but we need to name racism. Then we need to ask, how is racism operating here in my workplace, in our community, in my child's school? And when you ask that question, you're starting to look at structures, policies, practices, norms, values. These are all elements of decision-making. And then the 3rd stage, you name racism, you ask, how is racism operating here? And then we need to organize and strategize to act.
Last year, I'm pleased that the TCC, we were a part of the...
So when we look at health equity, especially from the standpoint of health disparities research and policy, we are looking...
Last year, we were able to be a part of the American Public Health Association's video series around health equity or addressing health disparities. And so Dr. Jones, Dr. Satcher, Dr. O'Feely, Dr. Harris Hooker from here at Morehouse School of Medicine, who is our vice president, I did a segment on health disparities and addressing health equity type issues. And so before we move forward to Dr. Okay, we're good? All right. I want Dr. Satcher to give us a few reflections that he has around health equity, addressing the health disparities, and just policy, health policy, particularly because we know, all of us should be aware that he has worked across various sectors of the U.S. In different capacities. He is Professor Emeritus here at Morehouse School of Medicine in the Department of Psychiatry and Behavioral Sciences. as well as the Department of Community Health and Preventive Medicine. And he is also Professor Emeritus in the Department of Family Medicine. He's the founding director of the Satcher Health Leadership Institute, as well as our senior advisor. He's one of my mentors and my primary mentor and sponsor, and has truly been one of, if not the most impactful person on my career and in my professional life. Thank you again, Dr.
Well, thank you very much, Dr. Holden, for that very kind introduction. And let me join in welcoming all of you here. It's great to see interviews whom I have not seen for quite a while. So it's good to be here. It's good to be a part of today. I was out jogging this morning, and since I was staying at the hotel, I ran past a policeman. And he looked at me and he said, "Oh yeah, when you get to the outreach, you gotta keep moving." And I told him that that's what I was trying to do, keep moving. But I was at the CDC 2 days ago, keynoting the 50th anniversary of the Division of Reproductive Health. And as many of you know, reproductive health has been one of the most controversial areas of public health. And that reminds me that I was in Arkansas the week before with Dr. Joycelyn Ellis, where she received an endowed professorship. And I say that because, as you know, Dr. Ellis was fired. And that's what she said. She doesn't let anybody say that she lost her job or she resigned. She announces very loudly that she was fired. Well, you know, there's something to that. Dr. Elders has 2 endowed chairs. I was at the University of Minnesota the year before speaking at an occasion when they established an endowed chair. So even though she was fired, her integrity still stands out. You know, an institution like the University of Minnesota, University of Arkansas, does not establish an endowed chair in your name unless they want you to be a part of the institution forever. You know, funds that are going to produce professors and students. And I say all of that to say that there is something to be said for staying the course. There's something to be said for integrity. And I was in Tuskegee about a month ago celebrating the 20th anniversary of the presidential apology for the Tuskegee study. And one comment that came to mind that Dr. Shalala made on that day 20 years ago, she was not there, but she was giving the commencement address at the University of Wisconsin. And she said, in public health, our ethics must be as sophisticated as our science. Now, nobody questions the sophistication of science in this country. We've won more Nobel Prizes in medicine than any other country. But what Tuskegee pointed out was that we have some problems with our ethics. And on that day, of course, which I remember as if it were yesterday, President Clinton pointed out that we needed not only to apologize for the Tuskegee study, we needed African Americans to accept the apology and forgive, and then to become involved in more in organ donations and in clinical trials. And those things are true. But until we get to that point where people believe that our ethics are as sophisticated as our science, we're going to have problems. I mean, you can establish an Affordable Care Act and feel very good about the fact that more than 20 million more people now are covered. And then somebody comes along a few years later and tries to wipe out the whole Affordable Care Act. That's what we're struggling with. And until we get past that, we're going to have trouble getting the kind of representation of African Americans in clinical trials that we would like to have. Our ethics must be as sophisticated as our science. One more story, and as I get older, I tell more stories. But, and it happened at the CDC, because after I spoke, we had a panel discussion of former directors of reproductive health. And they asked me to participate on the panel. And one question they raised was, do you remember what you were doing 50 years ago? I had to think about that for a minute. But then I did remember one thing especially. Most of you have heard about Dr. Benjamin Elijah Mays, right? That was a name that was so prominent in this country, and especially in the Atlanta University Center, where he served as president of Morehouse College for 27 years. He was an amazing man. He is given credit for helping to develop Martin Luther King Jr. and several other leaders. But anyway, I heard from Cleveland, because I was halfway through my program in an MD PhD program at Case Western. I heard that Dr. Mays was retiring and that he was going to give the commencement address. So I decided I had to be here. So I came back to Atlanta 50 years ago, in 1967, to help celebrate the retirement of Dr. Benjamin Elijah Mays. It was an amazing occasion, which I will never forget. But something else happened that week. For the first time in my life, I actually ate at a restaurant in downtown Atlanta and didn't get arrested. Now, when I was a student here, when I graduated in '63, the student movement rose to its highest heights. And many of us went to jail and even to prison, just trying to buy food in a restaurant, if you can imagine it. That was the reality of that time. And in my senior year, when I was head of the student movement here in the AU Center, I remember going to a restaurant with a student from Spelman. We had it all planned, of course. And they told us they couldn't serve us, and we refused to leave, and the police came and arrested us. And on the way to jail, this student, Annie Jo Weaver, said, "David, why don't we go on a hunger strike?" I was not much into hunger. I had my share. But that's still But we did. We decided to go on a hunger strike. And during that week on a hunger strike, there was news all over the world about students in jail on hunger strike. So Coca-Cola called a meeting of businesses in Atlanta, and they basically said, you know, if we're going to be a global leader, if we're going to be a global business, we can't have this kind of publicity. And so on that day, those business leaders decided that they were going to end segregation in Atlanta. And when business leaders make a decision, things happen, right? Nobody understood that other than Andy Young, who used that so well to do so much in the city. Well, that's longer than I planned to talk, but I'm trying to say to you, stay the course. Yes. Don't give up, don't give in. Just what they used to say, just because it's kind of hard, stay the course. Because as we used to sing, we shall overcome someday. But we've got to keep working for that. We've got to keep looking for allies. We have a lot of allies, but we got to find them, come together and work. I saw an article the other day, and I haven't been able to research it, but basically said that the mortality rate for African Americans had decreased by 25% in the last 20 years. I hope that's true, and it's pretty easy to find out. But I know now, as the opioid addiction is killing so many people, predominantly whites, it's also killing African Americans. So we have to make sure that we stay on top of these issues. Opioid addiction, suicide among people who are addicted. Those are all issues that we're all dealing with. And of course, as you know, Surgeon General Vivek Murthy was asked to resign last week. One of the things he did, of course, was to release the Surgeon General's report on opioid addiction. And so we've got to keep that going. We've got to keep working. So many black men have been incarcerated because of drugs, especially cocaine, crack cocaine back in the 70s and continuing. But opioid addiction is a more equal opportunity drug, so far more whites have suffered from it. Well, having said all of that, probably too much, Keisha, it's really important that we're here together, and that we come together because we share a concern about health equity. We need to keep coming together, keep putting our heads together, and find a solution. I'd have to ask one question. How many people in the audience have gone through leadership development programs at Satchel Leadership Institute? Okay, very good. I see former fellows, former members of the Community Health Leadership Program. And what about parents? I know we've graduated quite a few parents.
They're working, they're here.
Oh, they're here? Okay. So thank you very much. I ended my statement at the CDC the other day reflecting on Dr. Mays' favorite poem. I'll do the same here. It's called God's Minute. I have only just a minute, only 60 seconds in it, forced upon me. I can't refuse it. I didn't seek it, didn't choose it. Yet it's up to me to use it. I must suffer if I lose it, give account if I abuse it. Just a tiny little minute, and yet eternity is in it. Thank you.